Hi everyone, Dr. Amna Husain here, board certified pediatrician and licensed lactation consultant, here to answer your questions. So we have this great question on constipation. First of all, constipation is so normal. We see it very commonly when children start solids because it's a new food and the digestive tract is like, oh, I only know how to do breast milk and formula. But it's no problem. They work through it just fine. But we do see it in toddlerhood, sometimes with the potty training phase. Children just do not want to do number 2 in the potty. Sometimes we see it around the toddler phase because kids get picky and they have foods that lack fiber, and without fiber, it becomes harder for them to go, so they withhold. So there's a couple of things you can do. Prunes is one of them. Other dried fruits like apricots can help too. You can also use some juices like prune juice or apple juice, depending on the age. If it's a very young child, I sometimes actually instead take that and do a little mix of that in water, because honestly, water is really helpful too. So making sure that you're pushing water so that if your child does lack fiber, they're able to at least have some water in their digestive tract, into their colon, that they can pull in to help soften the stool. We also recommend things like probiotics or even good foods like yogurt that can help with keeping your child regular. And then also the pea fruits, so peaches, pears, prunes, like you already mentioned, plums. Some of those foods can also help to ease the burden of constipation. Those are some of the most common foods and juices, and that's really the only time I recommend juices. And then hydration tips that I recommend for constipation. But if your child's still experiencing constipation despite that, make sure you check it out with your pediatrician. We have some very safe, helpful medications like Miralax that can help, that I've even had my own daughter on in the past. So make sure you talk to your pediatrician. I hope that helps.